and welcome to the Hans Brinker Leadership Series, which is about extraordinary leaders in extraordinary times by Adi Partners. As founder and chairman Adi Partners, I'm delighted to bring you this episode of our leadership series. I'm Sanjay Viswanathan. COVID-19, the pandemic of the millennium, has truly changed our lives irrevocably. At the firm, we believe fighting this pandemic at the coalface, be it in healthcare, travel, supply chain, government, non-profit, and even the media, deserve recognition. As a global firm across 19 cities globally, between Asia and North America, that creates value through technology, I'm pleased that Adi Partners has conceived this program.
Glad. In fact, over the next several weeks, we will identify and share world-class practices to combat COVID-19 and create cohort of champions who can actually go ahead and influence and energize this war against coronavirus. I am Hiral Desai. In fact, through the Hans Brinker Leadership Series, we will identify extraordinary leaders in these extraordinary times. It's very similar to legendary 15-year-old boy who mythically actually went and saved his nation from being flooded. The series will provide everyday leaders a platform for sharing of best practices and appreciate their efforts in the fight against COVID-19. A journey will actually take us to India, Middle East, UK, Europe, America, Far East, and China.
This war, as we call it, is being fought on physiological and psychological terms. Our brave armed forces, our doctors, nurses, social care workers, and frontline professionals in multiple sectors. And what's interesting is doctors of Indian origin are the backbone, Hiral, of UK's publicly funded National Health Service, the NHS. And the other day when I was talking to a few people in various parts of the NHS, we realized that there are over 65,000 Indian origin doctors in the NHS, 70% of whom have been trained in India. It's quite remarkable, isn't it? In this episode, I'm pleased to introduce you to a champion of healthcare. Please welcome Dr. Joydeep Grover, a consultant of emergency medicine at Southmead Hospital in Bristol. Welcome, Joydeep.
Hi, welcome everyone. Thank you so much, Sanjay and Hiral, for having me.
Great pleasure.
Pleasure, Joydeep. Joydeep, let me take my first question with you. And firstly, I would actually want to thank you as well for sparing time for us from your busy schedule, because everyone is on the forefront right now when you talk to doctors. If you could just help us understand, what is the situation like on the ground in the UK? Because being in A&E, if you could just help us, describe for us the nature of clinical situations you're facing right now.
Okay, so right now, actually, things are reasonably calm because of the lockdown, which was about 3.5, 4 weeks ago. So we have seen a dramatic decrease in the number of patients with COVID which are coming through in the community. There are still people coming through, the ones who are getting it from, for example, residential homes or picking it up in hospitals or other institutions. But overall, the number of COVID that we are seeing is much lesser. And we did have a fairly dramatic decrease in normal or expected emergency attendances as well. And that has started to now grow up a little bit. So at this point of time, I would say that we are in a sort of a steady state of seeing some illness, probably not as much as we were a few weeks ago.
Right, so there is some bit of positivity that we are picking up. But has this changed from pre-COVID era as well? Because if you look at the demographic composition of people, how does that look like right now?
Has it changed from the pre-COVID era? Well, obviously it has, because we now see COVID, which we didn't see in the pre-COVID era. Also, our way of working has changed quite dramatically, because in the pre-COVID era, you could sort of walk in without masks, without PPE, without thinking that everyone's got COVID. Now the whole intention of the whole hospitals is quite changed. We've had to create areas within our department to take care of COVID patients. We have to had to train ourselves and our teams to in PPE, in the correct use of PPE, how to keep ourselves safe, and devise lots of different ways of coping with it. So yes, I mean, it is not the same as being in pre-COVID. There have been lots and lots of changes. I don't think particularly demography has changed post-COVID, and I'll say this because everyone is vulnerable. So, everyone can get COVID, and everyone is getting COVID, from young people to old people and to very old people. So I don't think there's been a big change. The change obviously was that a lot of people who would normally come to the emergency departments for seeking assistance for relatively minor conditions, they stopped coming in, heeding the demand and the request of the government to say that we should be allowed to focus more on the COVID part of it. And also, I think people realize that going to hospital would be a slightly risky thing because they would be interacting with other people with COVID. So, the public generally was quite sensible and did not come in with matters which were not absolutely urgent and immediate. So it did make a difference to the type of people we were seeing in that sense. The other change was that because of the lockdown, the amount of trauma, major trauma, so we are a major level 1 trauma center, the amount of major trauma went down, linked primarily to the fact that the traffic on the roads was dramatically decreased. Obviously, people were not going out to have their weekend recreation with so alcohol and drug fueled disease, which unfortunately does happen in any country, and that came down as well. So we did see a dramatic drop in the amount of major trauma over this period.
Very interesting, Joydeep. The other angle that I want to explore with you is the impact it has had amongst the healthcare professionals, especially when you think about mortality rates. And we compare mortality rates amongst healthcare professionals for COVID versus, let's say, SARS or the H1N1 swine flu. It seems to be quite dramatically different. And why is that?
Yes, so actually, I think it's dramatically different in a different way. So SARS and MERS actually have much higher mortality rates.
Okay.
And COVID has a relatively lesser mortality rate. But the differentiating factor is that with SARS and MERS, MERS, for everyone else who doesn't know, is the Middle East Respiratory Syndrome. With them, their incubation period was quite short. So those viruses declared themselves very quickly, and the mortality rates were very high. So in a sense, they were powerful viruses, but ineffective because it was easy to identify who was unwell. It was easy to quarantine them, and the viruses were so effective that they sort of effectively killed off their host and weren't really transmitting to anyone else because people just died from it. So, with MERS, for example, the mortality rate was in excess of 40%. Now, COVID, in that sense, is a very effective virus. It has a long incubation period. It, before it declares itself, a person has enough chance to spread it around. So, for 1 or 2 weeks, they may not know they have an infection. It is probably 8 to 10 times more serious than the flu, but it is not as bad as Ebola, for example, or MERS. So it does not have a mortality rate which is in tens of percents. It is about, I think, maybe 0.5% or thereabouts. Could be a bit lower, could be a bit higher, but we can come to that a bit later. But it is significantly more than what flu would cause. So in a sense, just being in that middle of being not really a horrendous thing which will kill everyone it sees, actually is working against us being able to contain it, because it doesn't kill everyone and it spreads a lot before you figure out where it is.
Got it. And when we think about chronic diseases, other chronic diseases that exist in the care pathway. How is the system currently looking to treat patients who come with that when they're already inundated with COVID-like cases?
So that has, I think, it is becoming a bigger issue. There are certain things which you can delay treating. For example, people with arthritis who need a new hip, someone has got a hernia which needs a repair, or elective surgeries. They can wait. Uh, there are things that we should not wait. So there's emergency surgeries, strokes, cancer treatment, for example. So these are the things which were sort of put on hold to some extent. Not actively only, obviously the elective part was put on hold, but people were staying at home, were scared to come to hospitals. So we are concerned that people might have had strokes at home and not sought attention for them in time, or they might have detected certain symptoms of cancer but haven't really presented themselves. And that is a cause of concern. So some data coming through in the last month or two is quite interesting, is the non-COVID related mortality statistics. And they have shown a spike, which is about 50% more than what we would have expected based just on COVID. So, the mortality rates have obviously gone up, but not all mortality is explained just by COVID. So we are quite concerned that it could mean either of two things: either that COVID is underreported, or secondly, that there are other people are dying of other causes not related to COVID, which they have probably deferred taking action on or seeking advice for. So things will become more clearer in the next, as we get more and more data and more understanding of this. But you're quite right, Sanjay. It is a concern. And that is why I think in the UK, at least in the last few days, we've heard repeated messages from the NHS leadership saying that if you feel you need help for strokes, for chest pain, if you found a bump or a lump, you need advice for it, please go and seek help, because that help is available. And to be fair, at this point of time, there is enough capacity within the NHS to take care of all of that.
Fascinating. When we look at lockdown itself as a mechanism to contain the spread of the coronavirus, and when we look at the impact of that, or the potential or desired impact of that, which is really to save the NHS, and then, of course, to make sure that people stay at home and also stay safe, what would you say would be the benefits of this particular mechanism, which is in many ways transforming society? Because none of us have really been used to, in any part of the world, to be still and in one place for this long a time.
Yes, so well, these are very interesting times, as you say, Sanjay. It is quite interesting to see that lots of personal freedoms have been restricted, and people have taken to it quite sensibly, I think. Lockdowns work. There is no doubt about that. They definitely work to slow the spread of the virus, and that has been seen in Korea, that has been seen in Japan, Singapore, in Germany, Austria, you name it. And not to say India, I think India absolutely have been far ahead in that sense. With a population of 1.3 billion, showing less than 1,000 deaths at this point of time over a period of 6 to 8 weeks is an astounding achievement for India, I think, and that's primarily down to the lockdown. And in England as well, I think the lockdowns were brought in a few days after social distancing was recommended. And when the government figured out that social distancing wasn't having the desired effect, they said we should go for a lockdown. The thing is that with this disease, this virus, it takes 2 to 3 weeks for any public health measures of that range to start showing some effects. So it does take that much time, and you have to sort of guess in advance as to which of the measures is going to work at what point of time. But if you look at the example of the United Kingdom, I think the lockdown was done, I think, at the right time, because it sort of peaked in the London and Midlands areas just at about the right time. I think the hospitals in those areas were just about fully stretched without being overwhelmed, as it happened in North Italy or Spain, or sometimes in New York even. That the hospitals were always able to provide ventilators when required and provide beds when required. And I think any delay in that lockdown would have been much more challenging. So in that sense, yes, and we can see that the lockdown has worked, because 3-4 weeks down the line, the cases that are coming through the front door are dropping dramatically. So they do work. The slight issue with lockdowns is whether they actually get rid of the virus. And, that is the problem, is that they don't really cure the problem. All they do is probably postpone it for it to happen later. So very effective lockdowns, and the two examples are Singapore and Japan. Very, very effective early on. They stopped the spread. And then once they were lifted, both Singapore and Japan are seeing a second surge of illness, which is then leading to further lockdowns and further disruption in normal activity. So eventually, whether a lockdown is a solution for the virus, probably not. The lockdown being a solution to control the amount of people who get unwell so that the health capacity is not overwhelmed, very effective.
But absolutely, everyone's asking the question as to for how long will countries look at lockdowns, because that's something which is going to be unsustainable, at least till the time a vaccine comes in, a cure comes in. A lot of things that are at stake right now. But this is one of the major challenges that we are looking at. But on a personal front, also, if I have to talk to you, can you help me understand, how are you keeping your family safe? Because you have been taking care of a patient during the COVID-19 pandemic. How big a challenge is that for you?
Okay. So firstly, about lockdowns, I completely agree. They are not a permanent solution, because you can't have everyone in a lockdown forever. Social distancing, much more effective social distancing and social responsibility will have to be maintained for a prolonged period of time. And I keep saying this, and I've said this to many of my friends and colleagues, is that this virus is going to be won probably not as much by medical intervention, but actually by social activism and by societies taking responsibility for their own behaviors. So I think this is a social epidemic in one sense, and the solution will probably lie in how responsible local societies are. Yes, things are quite challenging from the family perspective. So it has made a big difference to how I work. So I have started to go to work a bit early, so I can walk into the hospital through a non-clinical area. I change into scrubs in the hospital, then go to the clinical area, work in the clinical area. After finishing my shift, I have a shower, change back into scrubs, then change into my usual clothes to come back home. But before leaving, I have to go up and tidy up my workplace, wipe down my computers, mouse, keypads, my iCards, pens, everything else, and then leave through the non-clinical area. I have kept some wipes in my car, so I clean the doorknobs and everything else. And the idea is that, to reduce the chances of bringing this virus home to my family. So it has been quite dramatic. Obviously, the clothes which I wear come back and go straight into the wash. So yeah, it's been an interesting way of looking at how to protect or prevent things from coming back into the house.
That's a different routine that everyone is getting accustomed to as well. But any example that you would want to give us, Joydeep, especially probably a challenging decision that you had to take whilst treating with a COVID patient or dealing with them, and any major outcome that's actually got engraved in your mind now?
Well, we deal with different or difficult decisions all the time. As a consultant, you are having to make quite tricky decisions. I think the trickiest decision is to understand how the disease affects different people. So we do know that people above a certain age who have a lot of comorbidities are very vulnerable, and unfortunately, if they get this disease, they are almost certainly not going to survive. Um, I mean, to put it in perspective, I think I must say that even in people above the age of 80, if the survival rate is around 90%, so it's not all doom and gloom. But then there is this certain subgroup of people, particularly the ones who are very, very frail. And that's the example actually I probably want to give you as well, is that I had this call. So we usually get pre-alerts from ambulances saying, I've got this person, can I discuss them with you, and what do you suggest? So we had a call about a person who was in a residential home, a nursing home, coming to the end of their life, fully bedbound, advanced dementia, lots of other medical problems, not expected to live more than 6 to 8 months in any case, because they were coming, they were in the late 80s, early 90s. And unfortunately, they had contracted COVID, and it was highly suspicious because other people in the same residential home had got COVID. And this poor gentleman had a high temperature, was coughing, was even more sleepy than usual. And the question asked was, should we bring them to hospital? And the tricky decision was, well, what are we going to achieve for them? Because they have got an illness which is almost certain they won't survive from, because they generally are very poor. And if you bring them to hospital, you expose the ambulance crew to that illness. You then bring them through a corridor. You have other staff interact with them. They might pass the infection on to other people. But at the same time, you're wondering how can you best make that patient comfortable, because just because they have a very bad illness doesn't mean you stop treating them or making them comfortable or offer them some support and help and dignity. And those are the type of decisions where you feel, which is the best judgment to make for the patient and for the community at the same time. It was quite tricky that way. I think in the end we did agree for them to come to hospitals, just because we knew that the nursing home were not quite in a position to offer the patient some oxygen and some medicines to make them comfortable. So we said, bring them to hospital so that at least we can make them comfortable and offer them some support, even though we knew that it was quite unlikely they would survive. So those are the type of decisions which weigh in on you.
Yeah, and that's very insightful, Joydeep. And just to build on that, if we were to look at the aspect that you mentioned very intriguingly, that this is a social disease and a social pandemic, rather than just a clinical or a medical pandemic. If I was to take that out, and if we were to look at it from two dimensions, one is the technology and the impact of technology on our social behavior when it comes to interacting with clinicians and even the way clinicians deliver medicine. In this era of technology and virtual medicine that we see, where a lot more of the care pathway would be dominated by chats, videos, and phones. How do you see that in the years ahead? Is this something that, from a societal and social perspective, is here to stay?
Absolutely. I think this particular pandemic will change the way we think about how we deliver healthcare, as it will change in how we deliver work outside of the health system as well. So, virtually overnight, general practices went from having face-to-face consultations, seeing 50 patients a day per doctor, to having 95% of the consultations remotely, without any obvious adverse effects at this time. And the patients have taken to it. Doctors are finding that they can deliver good care through virtual or distance consultations. And I cannot see why this will not continue to happen going into the future. collaborations, conferences. For example, every week I have multiple Zoom and non-Zoom conferences now, dealing with various aspects of COVID and other operational aspects which people would have been huffing and puffing about previously. So things have obviously changed. People have adapted, innovated, and many of these innovations people will get so used to is that they will think, why did we not do it before? So I think definitely, and even looking at how people are working from home now, the government advised that you should work from home wherever possible, and I know of people outside of medicine in companies who completely did not allow their staff to work from home are now just agreeing with it, towing the line, and not seeing any adverse impacts of it. So I think in some sense, this has forced people to work in a different way. The number of cars on the road are dramatically down. So it makes you think that how many journeys were unnecessary, and whether this would really impact on climate change or become a model or a template. Obviously, no one wants to be cooped in the house forever. But I think a happy medium can be found. And we should certainly think about every time where we think, do we need to meet someone or we need to do something about this? We must stop and think, can we do this remotely? Does this really mean I have to get into a plane and fly 8 hours to go for a meeting which is going to last 2 hours? Those type of decisions hopefully will come into our mindset more often.
Fascinating. And obviously that leads me to the second dimension of the societal aspect of this pandemic, which is how it's going to dramatically change the way we live, we work, and we behave. For instance, a very simple social behavior of shaking hands is not going to be the norm anymore. Or, for example, when we talk to sociologists, they tell us that we will speak in the past tense about aspects like going to a cinema theater or a mall, essentially places that had aspects of social aggregation will now disappear in this post-COVID era. So from your perspective as a healthcare professional, what would you leave as a best practice for society to follow in this post-COVID era?
Oh, that's such a deep question with so many different aspects to it. I think from a healthcare professional, I think it is probably going to be our responsibility, social responsibility to everyone else, is that, we live in a connected world. Actions we take impact so many other people. Hopefully people will realize that the healthcare workers and the healthcare systems have adapted so quickly to deal with them. But actually, we are just a small microcosm of what they deal with. And effectively, we can be only as effective in a society which is also equally effective. Unless the society takes its own responsibilities of taking care of its own health seriously, there's no healthcare system which can deal with all of that. And I hope this social responsibility, if that is what comes out of this, I think that would be a great thing, isn't it? Because ultimately, all of us are responsible for our own health. And in an ideal circumstance, we should be concentrating on not sorting everyone else's problems, which are self-created or self-perpetuated. So I hope everyone will become more conscious of their own impact on the whole global health system.
Absolutely, and you certainly hit the nail on the head, Joydeep, when you speak about not just the here and the now, but what the impact this is now going to happen in the future for generations to come. The second aspect, I think, which is quite upbeat from what you say, is I think with the lockdown, and then if you combine that with some of the other measures that other countries have taken, like Germany, for example, with contact tracing and testing, then I think, and the wrapper that you talk about is the social behavior. If we can, deliver that to society, if you will, then I think what we're taking away is a very positive outcome that hopefully in the next few years, we will see the back of this virus.
Yes, absolutely. I think if people are thinking that this virus is just going to disappear in 2 weeks or 3 weeks from now, I'm afraid they're going to be very, very disappointed. It sort of reminds me of the era of HIV when it first came in 1980s, where people were scared and didn't know what was happening, and it took medical science a good 10, 20 years to get on top of it. This is, I think, very similar to that. This virus has arrived. It behaves very differently. It certainly isn't going away anywhere for the next 1 to 2 years. We are expecting to see it steadily seeping into the community and spreading. We will devise tools and we will find either vaccination or some sort of treatment strategy for it eventually. But this is not something which is just a blip. I think this one is going to lead to generational change.
Terrific. Ladies and gentlemen, that was Dr. Joydeep Grover. Joydeep, thank you very much for joining us on a very fascinating episode of Extraordinary Leader in Extraordinary Times. Don't you think, Hiral?
Absolutely, Sanjay. Great insights that we've been picking up from one episode to the other, especially right now that we've been focusing on the healthcare angle. But thank you, everyone. We will be back same day, same time to share more about another extraordinary leader in extraordinary times.
Thank you.
Thank you. Thank you for having me.
Great pleasure.